can't eradicate them again. What is the important message? The important message is that if you have a disease that is not going to kill you immediately, but it's going to be there for a very long time, yes, you can manage it. But guess what? You are going to compromise the quality of life that you live. So again, these are very important issues. So if you go back to the plan that we are talking about, all of these components are there. What I gave you earlier on, the 8-point plan is just a summation of the plan. But when you look at the plan, there are several contributing factors that are very important. There is something about HIV, you know, with all of the stigma associated with this.
But that plan does have an HIV component.
Absolutely. There are monies that have been set aside to address all of these programs that are included in the plan. So again, what I gave you were just highlights of this particular program. But I think it's a very significant plan. It's important to say, though, that we wouldn't expect, you know, and that's why, you know, we pride ourselves in having a country of democracy. You know, some people are not going to like the plan because they think it's advocating a single-payer system. That's not necessarily true. This plan provides individuals as well as small firms an opportunity to select, you know, from other insurers, you know, on what you are able to afford in a lot of ways. But the important thing is that the government wants to be there. The government wants to improve efficiency. And when I talked about the, you remember I mentioned the reserve fund earlier on, you know, that fund is going to be funded through two sources. One is going to be, once we cut out all the pork, you know, all of the inefficiency we had before, all of the monies that have been spent in the healthcare system that are not supposed to be spent in the first place, these monies are going to be used to continue to fund this reserve. That's number one. And then, of course, we'll generate new funds, you know, so other sources that will be used collectively to fund this particular effort. So again, it's very important, but the critics are going to be there. There are those who are, like I said before, are going to say, you know, it's a one-payer system. And we know some of the disadvantages associated with the one-payer system, which some people are now trying to blow out of proportion. They say it's very complex, you know, and the United States is a very culturally diverse population. So maybe just because a one-payer system might work in Canada or maybe in Britain doesn't mean it's going to work in the United States. There are those who argue that it's going to run down the facilities, you know, because everybody is going to think, oh, it's free for all, and then there's, you know, going to be all of those disadvantages. So we have to think about all of that. But again,
in all of your work in public health, do you believe that this is a very, very efficient kind of plan in terms of trying to meet the needs that we have dealing with health in the United States?
I think, as the plan itself says, you know, this is an improvement on what we had before.
Right, yeah, that's right.
So the point here is we are not looking at something that is going to be a total panacea to the problem, but we are looking at something. If you have a country, as we know, the United States, spending, you know, a more significant part of its GDP on health, more than most other countries, if not all, in the world. And yet we look at the outcomes that we have, you know, being less than acceptable for the most part. You know, especially in comparative terms, when you look at what other countries that are spending less are getting in terms of outcomes, you can see why some people are very frustrated. So again, I don't think it's a perfect plan.
All right.
You know, the more we try to scrutinize it, the more you'll find that there are advantages and disadvantages. But I believe at this point, on the basis of what I have seen in the plan, that it's, you know, it's a step in the right direction.
Very good. And of course, let me thank you. We've got about a minute and a half to go here, Dr. Kanu. Have you got any final statements that you'd like to make in reference to this plan? I think we might have about a minute before we end today. What are some of the final things that you would like to say?
Well, especially for those of us in the health sector, I think it's very important for us to try to read it. You know, it's one thing sometimes to be an armchair critic. You know, it's good for you to see something, try to understand what it's proposing, you know, and look at both sides of the coin, and then try to make criticism so that when those criticisms are levied, they can be justified in their attack. I think that's very important, but as a people, I think we have to continue to focus on prevention very heavily. We have to observe, we have to pay more attention to our lifestyles. When you look at causes of premature death, you know, 50% of premature death are explained or are a function of behavioral lifestyles.
Okay.
You know, 50%, and then you have the other 50%, you know, sort of shared between genetic factors, environmental factors,
but it is something that can be
access.
prevented.
Exactly.
Yeah,
you know,
good.
so again, these are very important.
And of course, Dr. Kanu, we're almost out of time, and let me thank you for bringing that excellent information about the President's health plan. And I do believe, as you've indicated, that it is a plan that has a lot of merit to it.
Absolutely.
And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.
The food banks don't have enough